Welcome back, everyone. Um, Today we'll be talking in continuation to our last video that was on the introduction to contraception. And since we are talking about every contraception, it is going to be like a series. I am Dr. Pallavi Kalghatgi and I work at Zenith Advanced Fertility Center in Pune as a senior IVF consultant and a gynecologist. And today we are more specifically going to be talking about the male condom. So, basically, the male condom is a type of barrier contraception. It is commonly the material that is used is latex, and nowadays polyurethane and polyisoprene condoms are also available. Basically, what this method does is that it prevents pregnancy by acting as a barrier such that the sperm cannot meet the egg. And along with acting as a contraception, they also prevent in the transmission of STIs, that is sexually transmitted infections, which means that it can be used for vaginal intercourse as well as anal intercourse. When used correctly every time, the condom can give an effectivity of up to 98%. But in a typical use, the effectivity can drop to about 88 to 89%. So why do I say typical use? What is it that couples do wrong that reduces the effectivity of the condom? So firstly, while tearing open the packet of the condom. So many times tooth or the teeth are used to tear open the packet. In that case, sometimes a sharp tooth can actually damage the latex part of the condom and create a break or a tear. Also, the second thing is that while placing the condom, the condom is placed over the erect penis and is rolled down to completely cover it. Now, if it rolls down easily, that means it's the correct side. But if it does not roll down easily, that means the wrong side is placed on top. So, what would you normally do? You will just turn it over and then use it. But in this case, what happens is that some of the pre-ejaculatory secretions that are present on the tip of the penis stick to the exposed side, and these pre-ejaculatory secretions also contain sperms in it. So these sperms can easily have access into the vagina and can cause an accidental pregnancy. The third important thing is using lubrication during intercourse. So using lubrication over a condom is absolutely okay, but when you use oil-based lubrications, or if you used Vaseline or oils or lotions, they can damage the latex material of the condom and can cause an easy break or tear in it. So while using lubrication, while using a condom, you must always go for water-based lubrication. The fourth important thing is that, did you know that condoms carry an expiry date? Yes, there is in very fine print there is a writing of where they mention the date of manufacture and the best before date, and you must pay attention because it is important, because when kept for a long time, again the latex material can tend to wear off, and during intercourse there may be an accidental break or tear which can again cause an accidental pregnancy. Also, a very important point, I think most of you would know this, but a condom is not reusable. Once used, it has to be disposed and it cannot be washed and used again. The fifth important point is that they should be kept properly. Even if it is in the packaging, it should not be kept in a very high temperature or a very low temperature. And when you place it in your bag or in the wallet, there is constant rubbing and friction of the packet, which can again, it can affect the material and cause minor holes or breaks in the condom. So these are a few points which every couple should understand and make sure not to miss out while using this method of contraception. Some people can be allergic to the latex material of a condom. So in such couples, you can use polyurethane or polyisoprene material condoms, which are again FDA approved, so you can use them very freely and they are also very easily available. Now, what are the situations where, in spite of using the condom, you may have to use a emergency contraception or the morning after pill? The first important thing is that if there is an accidental penetration without the condom, even if you have not ejaculated, you will have to use an emergency contraception, because like I said, the pre-ejaculatory secretions do contain a small amount of semen in it, and if it is the time of ovulation or if it is the fertile window, there is a very good chance of an accidental pregnancy. So if there has been a penetration without the use of the barrier method, and even if you have not ejaculated, you should consider using the emergency contraception. The second thing is, after intercourse you realize that there has been a tear or a break in the condom. That is again one reason where you will need to use an emergency contraception. One way to easily understand if there has been a tear is you can pass water through the condom, and if there is leaking of the water, that will again show that there was a break or there was a hole which you were not aware of. The third important thing is, while removing the condom, sometimes there is a spill of the semen near the vaginal area. Now the chances of pregnancy with this is very low, but since the sperm is a microscopic structure, you cannot see it. So if there is a spill near the vaginal area, if it travels up, it can lead to an accidental pregnancy, though the chances are very low. In such cases also, you should consider using an emergency contraception. Now, which kind of couples should consider the use of condoms? So basically, anyone who is interested in having multiple sexual partners, or who are not sure of your partner's history, and since it is used for